Hi, Roy Hall here. Welcome back to our little mini series. And today, what I want to discuss is the healthcare crises that's really being brought in by the health insurance industry. And it's not just health insurance industry, but it's working with the pharmaceutical people, working with the hospital system. What people don't realize with health insurance, the people that tell health insurance what's to cover are the people from the pharmaceutical industry, the hospital industry. They tell these people what to cover. And you'll notice health insurance really shouldn't be called health insurance. Our health insurance really is designed to be kind of like your car insurance or home insurance. Geico does not pay for the upkeep of your car, doesn't pay for the oil changes, the new tires, the wear and tear. They pay for things that happen to your car in a crisis, in a wreck. Your home insurance, Allstate, doesn't pay for the upkeep of your house, doesn't pay for the painting, mowing of the yard, planting of trees. They pay if you get hail damage or fire damage, or if you have flood insurance, they pay for floods. They don't pay for the upkeep. Same thing really should be happening with our health insurance. And when you look at health insurance, tell me, when does it pay to get you healthy? What they pay for is to keep you on medications or pay for surgeries. They don't pay for good food. They really don't pay for instruction on how to get well. And they really don't pay for gym memberships. The other thing that's happened with health insurance is they've taken away our accountability. And I hear people all the time saying, I can't do this because my health insurance won't cover it. And I can do whatever I want because if I get sick, my health insurance will take care of me. They will take care of me by giving me medications, by letting me have surgeries. The other thing that's happened with health insurance through Medicare is they shorten down or they cut down the money that the physicians make or the nurse practitioners make for seeing people. So if that practitioner wants to make a good income, what do they have to do? They have to see more people in a day. How do you see more people? Well, you shorten down that office visit. And now a standard office visit is about 20 minutes. And I'll ask you, how many times you really get to see your provider the full 20 minutes? And it's almost never. And the reason why people don't realize, but in that 20-minute segment set aside for you, when I was in traditional medicine, it would take me about 2 minutes to review the computer, the medical records, to see if you've been to another doctor, been to the hospital, had a CAT scan done, a blood test done. And then on the back end of that visit, it'd take me about 5 minutes to tell my nurse I need these labs ordered, I need these tests ordered, and then I have to dictate or type my note. So that brings us down to about 13 minutes. And what we're supposed to do when we walk in that exam room, we've got to do a little chit chat. And so today is, look at my calendar, May 21. So if you come to my office today or tomorrow, I'm supposed to sit down and talk to you. Well, what are you going to do this holiday weekend? Are you doing anything special? Any barbecues? Where are you going? So we got to do a little chit chat. And if it's a month from now, end of June, I'm going to say, what are you doing for the 4th of July? How's your summer going? So now we've taken 13-minute office visit and chewed up another couple of minutes. So now we have about 10 minutes to visit. And in 10 minutes, the doc doesn't have time to get you well. All they have time to do is find out what's going on and write you a new prescription. So if you come into my office because you can't sleep, there's causes of insomnia. It's not an Ambien deficiency, promise you. But I don't have time to figure out what those causes are. So all I have time to do is write your prescription for some Ambien, and I say, go home, take this every night for a month. Come back and visit with me in a month and tell me how it's working. And you take your prescription, you get it filled, you start taking that medication every night for your sleep. You come back in a month, and I say, how did it work? And you say, it worked wonderful. I think, oh, perfect. Here's your new prescription. Take it, come back in 6 months. Let's see how you're doing. Now, if you say, Roy, it didn't work at all, I think, crap, what do we do now? Oh, yeah. Here, let me write you a new prescription for some Elavil. Take this every night for a month. Come back and tell me how it's working. That 10 minutes, I don't have time to figure out why you can't sleep. I just have time to find out you're not sleeping. Okay, here's your prescription. Same thing happens with diabetes. Come in and your blood sugars are high. I don't have time to figure out why the sugar's high. I just have time to say, here, let me give you a prescription. Come back in a month. You come back in a month. Sugar's still high. I think, crap. Okay, now we got to add a second drug and a third drug. And we never really get you well. All we end up doing is get you on some new medication. So Health insurance, we need health insurance. The issues are not being discussed right now, what health insurance should cover. It's dictated by the pharmaceutical people, it's dictated by the hospital people. That's one problem. I'm going to talk on the next issue about hospitals, how they're really not helping us out either. So again, have a good day. Talk to you later. Thank you. Bye.